Welcome to Public Health Dayton and Montgomery County's webpage. This slide presentation is going to provide you with information on head lice. So what exactly are head lice? Head lice are small wingless insects that spread almost exclusively by head-to-head contact. They cannot fly or jump. They do not spread disease. You get them by sharing hats, combs, brushes, and upholstered furniture just used by the infested person, but more so from anything that touches the infested person's head, neck, and shoulders. Basically, you can get head lice from anywhere. Head lice cannot live very long off a human. They need a human's blood to survive. They typically only survive about 40 hours off a human. Anyone can get head lice. It does not mean you are dirty or have a dirty home, and I think that's important for everyone to remember. This is the picture of a typical adult louse. A lot of people don't know what they look like. They are typically transparent looking, which means they're kind of clear, but they'll look a little darker after a feeding because they have just ingested blood. You can see that this one has a little bit darker appearance down the middle, so it probably has fed recently. So how do you know that you had lice? Well, the main symptom is intense itching. If you or your child are itching and you've received a letter home from the school that your child has head lice or that a child in the classroom has head lice, then you definitely need to make sure that you check. They are small, transparent to light brown looking, flat, sucking insects. So what happens is lice bite the scalp to feed and they lay eggs. What makes the head itch is the feces or stool that they excrete on the scalp. That is where the intense itching comes from. Diagnosis of head lice usually comes from finding nits or live bugs in the hair. Nits are the eggs that the head lice lay. They are yellowish white, tear-shaped eggs that are laid close to the scalp and they attach to the hair shaft by a cement-like glue that is produced by the louse. And this is a typical picture of what head lice can look like. The picture on the left shows what newly laid eggs look like. Again, they're a white yellowish appearance. And then the picture on the right is what they can look like after they've been laid, after they've hatched. So kind of gives you an idea of what to be looking for. If they are more than a quarter of an inch away from the scalp, if they're about a quarter of an inch or higher on the hair shaft, then that means that they've been there for a while, they've already hatched. So that's a good indication that they've had a case of head lice for a few days. So where will you typically see the lice? Lice do not like light, so they will move quickly away from it. Sometimes it's hard to see a bug just because they are so quick. They tend to really like warm places, so you will see them behind the ears, around the nape of the neck, and the crown of the head. So how do you know if it's head lice or if it's just dandruff or dry scalp? The nits are very hard to remove. You typically will have to use your fingernail to loosen them and remove them from the hair shaft or use a lice comb. If it is dandruff or dry scalp, the flake will move easily when you move the hair. And this is an example, two examples of where you might find head lice. Again, the nape or the back of the neck and behind the ears. Those are warm spots. The crown of the head's warm because that's where heat escapes. So those are typically places where you will find head lice. So now that we know we have head lice, what do we do? First and foremost, you need to use an approved lice shampoo or cream rinse. Ask the pharmacist or call your doctor to see what they recommend. And then make sure you follow the instructions exactly as they are written on the shampoo or cream rinse. Check all your family members, but only treat them if they have head lice. Do not treat babies, and if you are pregnant or nursing, call your doctor before you use any kind of treatment. And the same goes for babies. If you end up with a baby that does have head lice or nits, you need to call the pediatrician to find out what they recommend you do. Now, once you have treated them, it is important to remember to remove all the nits from the hair with a lice comb. A regular comb, the teeth of the comb are not close enough together to get all those nits out, so you need to have a special lice comb. Nits can survive the medication treatment, so it's important at this point to take all the nits out, to remove all the nits. You're going to separate your child's hair into 1-inch section and comb each section. Any nits that cannot be removed by the comb, you'll need to use your fingernail and pull them off, and then make sure you clean your nails immediately. If you do not remove all the nits, your child will become reinfested with head lice. So it's real important to remember to try to get all of them out. You want to continue to check your child's hair nightly for 2 weeks, and then after that, probably once a week until you know for sure that all of the head lice is gone. If you have nits that are very hard to remove, there is a formula that you can use to spray on the hair, and it's a mixture of half vinegar and half water. You apply it to the hair, wrap it in a towel for 30 minutes, and then the nits should come off easier either using your fingernail or a lice comb. So when you're cleaning, you need to remember that any clothing, hats, bedding, backpacks, anything that has come into contact with the child's head, neck, and shoulders within the last 48 hours needs to be dry cleaned or washed in hot water and then dried in a dryer on high heat for 20 minutes. Anything that is non-washable, such as stuffed animals, dolls that have hair, soft toys, decorative throw pillows, headphones, anything that can't be washed needs to be placed in a dark plastic bag and sealed for 14 days, and then either put in the basement, in the garage, someplace away from the house, inside the house. You want to thoroughly vacuum rugs, mattresses, carpets, upholstered furniture, and the seats and headrests of all cars, and car seats if you have small children still in car seats. Again, anything that the child's head, neck, and shoulders has come into contact with in the last 48 hours. And then wash all combs, brushes, and any hair items in a lice shampoo or boil in water for 5 to 10 minutes. If you have hair bows, hair ties, the best advice is just to throw those away and start new. The next step is to really inform family, friends, neighbors, the school, or other people who have had close contact with your child. Let them know he or she was treated for head lice and that they should check their family members and treat as needed. If your child has a reaction to the lice product used, or if you cannot totally get rid of the head lice, you need to call your doctor. There are other options out there, and it's best to let your doctor recommend what they think would be best to treat your child. And the main points to remember with head lice is anyone can get them. Again, it does not mean you're dirty or your child's friend is dirty or they live in a dirty environment. You can get them anywhere. You need to remember that all the nits need to be combed out, that you need to check them every day for 2 weeks, and then about weekly after that to make sure that you have gotten rid of everything. Notify anyone that has been around your child that they have been treated for lice. And then make sure you always follow the directions exactly as they are written on the lice product. Clean your home environment completely, and then call your doctor with any problems or questions. And if you'd like any other information on head lice, these websites have some great parent information that can help you and give you some advice as far as treatment, cleaning, next steps, those kind of things. So again, if your child has head lice and you have any kind of questions or concerns, please call your doctor because they will be best to guide you on the best way to treat your child.